So besides the COVID cases, medical resources also very critical in during the COVID-19 pandemic, because when you understand the medical resources, so how many beds or how many ventilators is needed in some areas, it can be really helpful for contain the COVID-19 pandemic. So here are the index that we include in this data set. It is from the year 3. And they are relevant to the medical resources about the critical care staff. It is, so for these data sets, it has doctors, nurse, and therapists, assistant. It has the estimation of the and the statistics of these numbers in each health facilities. And the other important data sets that are relevant to the health issue is the chronic disease risk factors. So some research has indicated that the chronic disease, especially for the patients who have chronic disease, have great potential. So have great potentials, or more likely to have serious form of COVID-19, especially for the patients who have respiratory disease before. So here's the data sets from the CDC. And here is another data set about the demographic and socioeconomic data set from Census Bureau. This is popularly used in the social science field. It includes education, some incomes, and also ages, demographic information. So for the mobility data set, so human mobility behavior has great impact. It is critical to understand the COVID-19 the transmission patterns. So, and all these the behaviors can be connected from different kind of sources, such as the mobile phones and also transportation systems, such as airline flight and public transit data set. And this kind of different data sets have different pros and cons. For example, the mobile phone has accurate data set. It is accurate data, however, it is private and confidential. And for other data sets, it can indicate the inter or intercity mobilities, but they still have some limitations. For example, the air flight data sets, it doesn't include the passenger numbers. It's more like a sampling data set. And here is a demonstration that we use the air flight data set in the United States. We can see here it has, sorry. Yeah, we can see that the movement change over time during the pandemic. The networks become sparse. So besides mobility from transportation system, we also have some other data sets relevant about the social activities, because such as the Google and Foursquare and SafeGraph, they have mobility reports. The reports indicates the human movements, change over time just cross different places, such as retail stores and some pharmacies and workspace. They calculate the frequencies changes over time. And here's this also the pros and cons of these different data sets. For the Google, it's global wide, it's in single file, it's easy to download. And for other, the Foursquare and SafeGraph is hard to get the data.